It has initially stopped all surgical treatment. Then we were able to reactivate and start seeing patients again. And so from a surgical perspective, I think it's, depending on what institution you're at, I think it's safe for a patient to have their treatment. That's number one. Number two, I think that it has allowed providers and patients an opportunity to use digital platforms a little bit more effectively. We are, half of my patient engagement right now in an outpatient setting is virtual now, which the patients seem to love. It hasn't diminished my ability to render their care or evaluate their problems. But I think it's also good for me because I'm able to see more patients in a allotted period of time. And so I think it doesn't obviate the need to see patients in person or do their physical examinations, because it's incredibly important, particularly when it comes to spine care, to have that face-to-face interaction and make sure you're able to get a nice and accurate physical examination that correlates with the imaging, that correlates with the patient's history. But COVID has really changed the field. It's really accelerated our adoption of digital platforms in a way it hasn't. I think the other thing that it's done for the spine community is two things. I think on the positive side, it's again accelerated our adoption of digital platforms. It's allowed us to expand our reach among our own peers and how we educate and how we exchange ideas. But it's taken away that face-to-face interaction, which I think has a really tangible and palpable value.